Hi everyone, I'm your host Emma Burgic.
And I'm your co-host Jose Camacho.
Whether you're a player or a coach,
or you're just passionate about what you do and you want to be the best at it,
this is the EMAzing Podcast for you. Today's episode is sponsored by MatchSet. MatchSet is an amazing company that provides players with incredible equipment and apparel. With MatchSet, equipment does matter, and they make sure it won't slow you down.
Use code TennisWithEmma to get 10% of Match Tennis today.
Hi everyone, thank you for joining us for one more episode of the EMAzing Tennis Podcast. I think that's 30 or 31, I don't know, we're up there. It's been a while. And we have another amazing guest, Dr. Mark Blank. We know each other well because he is the director of USA Sports here in Wellington. So you guys have a clinic in the Polo Club, and you also have one in the Wellington Green Mall.
Correct.
Just another amazing resume. He is PT and DPT, right? Physical
Correct.
therapist and doctor in physical therapy. He worked for the UCF football team, the San Diego Chargers, in injury prevention as well, right?
Yeah, sports medicine. As an athletic trainer, yeah.
Today's video is sponsored by Lucky in Love. Gone are the days of ladies' golf and tennis apparel that all look the same. Lucky in Love is ushering in a new age. The high-end women's apparel brings options fit for the modern, expressive woman. Partake in the ultimate luxury and shop Lucky in Love for your new favorite fashion items for women and use code EB20 to get 20% of your next purchase.
And before going to being the director in USA Sports, he was also working in the Hospital for Special Surgery in West Palm Beach, working with some of the best orthopedic surgeons. And he specializes in dry needling therapy, trigger point needling, kinesiotaping. Okay. Movement screening and selective functional and movement assessment. So I think that I literally picked some of the points because it's a really big resume in everything you've accomplished and everything you've studied. So it's great to have you, Mark.
Thank you. I appreciate you having me. It's good to be here.
Yeah, Great. I'm really excited to have Mark here because Mark is a big part of Mark and his team. They're a big part of my comeback journey because they've been with me since day one, helping me keeping
me in one piece,
which was really difficult because every week I would come with something different. Hey Mark, this hurts. He's like, oh God, what's this?
It's never a dull moment.
This is a full-time job, right? She's a Lego.
For a true athlete, that's the way it's supposed to happen. So we're just glad we can be here to help put you back together.
I mean, thank you so much. I really, really appreciate it because I honestly don't know what I would do without you. But I asked this question to one of your PT, Spencer. Is an athlete ever going to be at their 100%, like feeling like?
Yeah, I mean, at the end of the day, everyone's 100% is different. So 100% as far as are you going to perform with absolutely no pain, no injuries, no chronic issues, that doesn't often happen in sports. We constantly are swimming against the current, and we're really just trying to swim faster than the current. And that's all comes to down to taking care of yourself and obviously from everything from just your daily motions, nutrition, treatment, therapy, injury prevention, strength and conditioning. All of that goes into play. And obviously, it's when you're performing, particularly at the level that you're performing at, it takes a toll on your body, and it's supposed to. If you're doing it right. Now, what the focus should be is trying to minimize the risk of injury as much as possible, and maintain that level, and work towards being able to perform at that level without without those injuries getting worse, and trying to keep them at bay.
Yeah, I agree 100%. I wanted to ask you also, before I forget, with the dry needling, okay? I hate it and I love it. It's a love-hate relationship.
It's one of those relationships, yeah, we hear that a lot.
Because I see it helps me a lot. But can you tell me a little bit more about it? Like, when did you start doing it, and what specifically is it good for? How do you decide that a person needs dry needling?
Yeah, I was first exposed to it when I was a student doing one of my internships in PT school, and this was 12 years ago. And at that time, there were only about 5 states that you were allowed to do dry needling as a physical therapist, chiropractor. And Washington, D.C. was where I was doing one of my internships. That was one of the places that was approved. So that's where I was first exposed to it. And a lot of people hadn't been because, like I said, only 5 states, I think, at the time were allowed to do it and were actually doing it. Fast forward 10 years later, Florida was, I think, one of 5 states that were left not approved yet. But I had known since then, as soon as they approved it, that was something that was going to be the next certification that I was going to pursue, because I saw the effectiveness. I saw, all the patients and athletes that benefited from it. So that's what I did. In 2020, they approved it in Florida. So physical therapists were then allowed to do it. And so that's what I did. I went and got certified. And really the main point of the dry needling is, we use acupuncture needles different than acupuncture. Acupuncture is its whole separate scope, nothing of what I do. With the trigger point dry needling, we're just targeting very specific structures, muscles, tendons, ligaments, joint, whatever the injured area, damaged area. And the whole point is that the needle is causing micro trauma to create a further healing response to that area. So it kind of speeds up that healing process, helps flush out some inflammation, is really good for recovery, for healing. It also loosens up the tissue as well. So a lot of soft tissue injuries and tightness, chronic tightness and adhesions, we can get the needles specifically in there. I mean, our hands are great, but we can only reach so deep. So sometimes specifically for those trigger points, we can get right exactly in where we want to be, and really loosen up the tissue. I like to use the analogy, if you think of a plate of spaghetti, and those are your muscle fibers, right? And the spaghetti is all intermingled, and those are your muscle fibers, and your muscle fibers are supposed to lay down in this nice pattern. So that if you think of the needle as a fork, we're going in and we're twisting up the spaghetti to make it a nice, a uniform pattern. And then when we pull the fork out, it just kind of lays flat in this nice, a much looser pattern. And that's the analogy. I'm a visual learner, visual thinker. So if that helps you kind of envision, what we do with the muscle fibers, that's what makes sense to me. And we get a lot of benefit from it, and people like it a lot. So it's been a really good addition to all the other different services that we offer.
Right.
The only thing that I got out of that is spaghetti, and I'm hungry now.
No, that's great. And for athletes that listen to this, how do you? I feel like a lot of athletes are really stubborn, right? We got one big one right here.
I've never heard that before.
Right? Especially, with Emma. But so what do you think is the biggest advice you would give? So, I feel like a lot of athletes just go when the problem's already there, and when it's sometimes, unfortunately, a little too late. And what would you recommend for just people that are listening to that are just younger players, right, that can really prevent a lot? Is it stretching? Is it a mixture of stretching, resting, or what's the biggest thing you would say to not only treat things when it's already too late?
Yeah, so a big part of what we do, or I should say a bigger part of what we should be doing as a physical therapist and as part of the whole healthcare team, is focusing on injury prevention.
Right.
And obviously that's where your strength and conditioning, that's where all your other training and whatnot comes in. But there's also a rehab component or maybe a prehab component to that as well. So we do, some of the letters, that you were reading, that FMS, that functional movement screening, as well as the SFMA, the selective functional movement assessment, and other tools of the sort are good screening tools that we can screen for chronic, tightness, muscle imbalances, different issues that predispose us to injury, and identifying some of those imbalances and weaknesses early on so that we can specifically do corrective exercises to address those issues are instrumental to preventing those injuries and again minimizing the risk of injury or at the very least the severity of injury. At the end of the day, traumatic injuries happen. It's part of sports, but it's the chronic injuries that tend to hinder us a lot more than some of these acute injuries. And a lot of those chronic injuries can be avoided by the correct prevention and early identification of some of these, like I said, some of these imbalances and weaknesses weaknesses. So that's really the main thing is don't wait
Right.
until it's too late.
Right.
Don't wait until you're hurting. I use this analogy, when I was in a course years ago, and the presenter, don't quote me on the numbers, they're not the correct numbers, but it was something along the lines of the point he was making was the prior year there was something like $57 billion spent in cancer treatment in the United States. And then there was also $92 billion spent in orthopedic injury care. So the whole point was your health insurance pays for an annual physical at no charge to you. Most health insurances do, right? Because they know that if they identify some of these issues with routine blood work and routine just physical assessments from your primary care physician, that they're going to identify some of these issues well before they turn into bigger issues that are going to cost the insurance companies more money, right?
Oh, wow.
But your insurance doesn't pay for you to have an annual physical therapy screening or any of these movement screenings. And the point is why not? If you think about all the dollars that we spend on orthopedic injuries and care, a lot of and majority of these injuries can be prevented theoretically by identifying them earlier. So especially, and this is just for your everyday person. Now, when we're talking about your athletes all the way up to your elite athletes, it's even that much more important. When you're in professional sports, especially the team sports, whether it's football, basketball, this is part of players' everyday routine. They go to the facility, they have their team meetings, they go to practice, they do their weight training, they go to treatment, they go to, this is part of their they have that athletic training room, at their disposal every day. They're in there 6-7 days a week, particularly during season. So some of your, obviously, like tennis where it's less team sport and you're kind of, you have your own personal team. Sometimes it gets a lot harder, but that's when, like Emma is, seeks that attention to try to, get those types of treatments and to be able to help her continue to perform at the level she's performing. So, that's the main thing is don't wait until it's too late. See your local physical therapist or a chiropractor or, any of those related healthcare professionals that you trust and that are good, that can, not just give you the generic rundown, but actually take a look and not just from an orthopedic assessment, but also from a sports specific assessment to kind of know specifically the needs that you require, so that we can look at certain common issues that we see in that sport, that we can again identify issues early on and correct if we need to.
Are you ready to immerse yourself in the world of beauty, wellness, and self-care? Look no further. Rejuvenate is a medical spa in South Florida that offers a wide range of beauty and health-improving treatments and therapies. Their goal and aim is to improve your quality of life and ensure a healthy glow on your skin. Make sure to check their social media and to visit their location here in South Florida.
And remember to use code EMMA20 for 20% off your service.
Yeah, no, that's fantastic. And I think there's only so much that you can do on your own, like this, like especially in the athlete side, that you can stretch and everything. But what you guys know and how you guys have been prepared to, it's incredible, and you can provide so much knowledge to again like prevent injuries for people that really we have no idea of how to properly take care of ourselves, unfortunately. And I think I read this book by his name is Michio Kushi. He was like the father of microbiotic food in Asia, and he said if something hurts, that's your body screaming that something's wrong already. Right. So it shouldn't get to the point in which something's like, oh, I really need to go to the doctor. Right. You can really prevent it with all this kind of therapy. Do you have a question?
What is that book?
Michio Kushi is the author. He's the father of microbiotic nutrition in Asia, and he brought it to America.
She heard something about food again, and
she's like, where do I get it?
Yeah, we're back there.
Yeah. Well, that's great.
So you see right now at your local office, or what did you say, office?
Clinic, office, sure.
Clinic. What kind of patients do you see the most?
We see everything. My clinic, we specialize in more sports medicine. Not that you have to be a professional athlete, but everybody we see there's a very active population. We have anywhere from 8-year-olds to 90-plus-year-olds. maybe lesser of the end ranges, but everyone we see, even if it's our older Medicare population, they're playing golf and tennis 5 days a week. So we see active patients. That's kind of our niche and more sports medicine related type injuries. But we see everything from an orthopedic standpoint, from basically head to toe, and then really across the spectrum.
So your focus was always like after PT school, you focused on sports medicine, then a little more about what I see from your career. But can you talk a little bit more? And I'm asking this because my girlfriend is going to PT school in University of Florida. Okay. And she said, like, she's told me how she's seen that like it's overpopulated, like sports medicine. But just briefly, is there other ways that like a PT can go in terms of like other there's lots of different areas of expertise from anywhere. So you have PTs that they'll go into an acute care setting, more in the hospital, a neuro setting, long-term care facilities, nursing homes. There's your outpatient orthopedic. There's your more sports medicine. There's these people that specialize in geriatrics, people that specialize in women's health, pelvic floor type issues. So there's really a very, very wide variety of different. A physical therapist is not just a physical therapist, is a physical therapist. There's different fields just like doctors. Some doctors are primary care, some doctors are orthopedists, some doctors are cardiologists, so there's lots of different niches and different areas of expertise. I could not go into a hospital and have the same type of, yes, I went through schooling, but that's not my area. You don't want me treating you at your bedside if you're after your visit to the emergency room. Yes, there's lots of different options and different, just like anything else, different strokes for different folks. It's whatever the interest is in and their background is in. So no pun intended on the. That's great.
Let me go back because you interrupted me. I was not done with my
Go
questions.
ahead, Emma. I apologize for that.
So what do you see the most? Like, what's the most top 3 common injuries people come into?
If you go into any outpatient physical therapy clinic, low back pain is going to always be the number one. 80% of people at some point in their lives will seek some form of professional medical attention for low back pain. That was a statistic from years ago from an article that I remember reading. So, and that's just people that actually seek help, whether it's your local doctor, physical therapist, chiropractor, orthopedist. 80% of people at some point in their lives will have some sort of back pain, low back pain, that will make them seek medical attention for. So if we think about that, we think about either we were built very poorly or we just don't train the right way for life, let alone sports. So low back pain is definitely up there, but I see a lot of shoulder and a lot of knee injuries as well. And then, really all the major joints. So, elbows, ankles, hips, neck, head to toe, really. There's probably more specific percentages of all that stuff, but it's kind of somewhat of a spread mix of all of that stuff. Yeah.
Who treats you guys? I'm just asking, like a PT, do you guys like treat each other or do you treat yourself?
If you come in during our lunch hour sometimes, it's not uncommon that I'll be on the table with Spencer, my other physical therapist, standing over me, or vice versa. So yes, and that is important because especially like they say, doctors make the worst patients. Physical therapists are no different in the terms of sometimes if we have an issue and we might think in our mind, oh, well, I know what that is. So then it's easier for us to ignore it. And that's not the advice we would give other people, but that doesn't mean, you always take your own advice. But we try to be good about, when things are, we use our bodies a lot to help other people too. So we have to try to keep ourselves maintenance as well. Otherwise, if we can't treat people, then that's not good for business either. Yeah. So we can't fall, go down with the ship. We got to keep it going.
That's interesting because I can relate to that because I've been a coach.
Exactly. Like I think everyone has that, right?
Yeah,
like a coach is a coach.
And now I'm being coached by a coach, but I'm still a coach. Yeah. So it's like,
who cooks for a chef?
Who does?
That I feel like they can do that themselves.
But yeah, I'm like, I know what you're saying, but I have my own opinion too about that. So anyways, let's get into the tennis world. Okay.
Sure.
Let's talk about what is the most common injury with tennis. We all know this.
Right. Well, I think the obvious answer, right, is going to be tennis elbow. That's why they named it after it.
There you
go. So, we tend to see it a lot more in up and coming or more recreational tennis players. You actually don't see it very often. I know we've treated a number of things for you, right? I don't recall tennis elbow being one of them.
Actually, no, yeah.
So there's a saying out there: you'll rarely ever treat a professional tennis player for tennis elbow.
Really?
Yeah.
Because you train properly and specifically for your sport. But when you think across the broad spectrum of lots of people play competitively, but whether it's a local recreation league or a travel league or whatnot, or even just the younger athletes, the younger tennis players that maybe haven't gotten into those good routines quite yet, those are the people we tend to see the things like tennis elbow, because they're not necessarily doing all the same level of strength and conditioning and stretching and whatnot. So again, they tend to have some of those chronic tightnesses and weaknesses and muscle imbalances that predispose them to those specific muscles that are utilized in tennis more than any, which is what creates those issues like the tennis elbow, which specifically is either a straining or injury or just chronic tension of those extensor muscles in the backside of the forearm where they attach to the outside of the elbow, which is commonly used, when you're in your backhand. So people with a very powerful backhand or whatnot, it might not be that there's actually a problem with these tendons. They just might be so strong that the muscles on the opposite side are lagging behind. And again, it creates that muscle imbalance that there's just so much overpowering of these tendons where they attach to the muscle. They're chronically pulling and pulling and pulling, and that leads to inflammation. And that's what tennis elbow, the medical term we call lateral epicondylitis. That lateral epicondyle is the bone, and itis means inflammation. So lateral epicondylitis, inflammation of that bone, which is where those tendons attach to, also known as tennis elbow. So the fix to that is really finding that imbalance and really getting in there and loosening up those muscles and tendons on the backside of the forearm, and then strengthening the opposing muscles and tendons to restore that balance so it takes that tension off. And that's what we do with lots of different things like the trigger point dry needling. We do Graston, also known as scraping, and then just a lot of our own hands-on active release, soft tissue work, and different things that we do. We do some cupping back there. All these different soft tissue treatments, manual therapy treatments that we can loosen up those muscles and tissues on the outside to relieve some of that tension, and then we work on strengthening the opposing side to restore that balance. And that typically is very, very successful, especially when treated early on. When it's very chronic and people come in and say, "Yeah, I've been dealing with this issue for 2 years, and just I haven't done anything about it." It takes longer to treat at that point.
Do you think it has to do with like what you said about the professional level? You don't see it that much, and then the recreational level you do. With the technique, you think the technique,
Absolutely.
like a good technique,
100%.
Absolutely
improves?
Yeah.
That's why. That's
Sorry,
why
doctor. I didn't know.
It's no.
Sorry, doctor. Sorry.
Yeah, but like
PT.
that's
BPT.
why you have tennis elbow.
I don't have tennis elbow.
You did.
I used to have tennis elbow. Now I'm fine. But
early.
yeah,
in the
it was
way
old
at the
days.
beginning
It
of
was
the
my old days.
Yeah,
Absolutely.
last
As an amateur. No, what I have a lot of problems with is my shoulder, and I went to Spain, and it was at that point it was really bad when I was over there,
exactly.
and I got but that's one thing I told Spencer a million times. He asked me but where? Point. I can't because it feels inside. It feels on the very. I can't. You know how something hurts and you can massage it, and it's it hurts, but you can feel it.
Right.
This I can't. I can't massage it because it feels as really deep on the rotator cuff, and then I'll be if I reach something from the so obviously when I'm playing tennis, when I serve and I don't warm up really really well, it's horrible. But they told me in Spain it's tendinosis, so it's like a chronic, like I don't know what it is. It's not tendonitis, it's tendinosis, but it hurts and I can't get
just
rid
a
of it.
different phase of the tendonitis.
Okay.
It's more the acute phase. So it's the beginning stages, which turns into more of a tendonitis. Essentially, it's the same thing. Just different stages of it, and we treat it the same way. And that's when people come in and we do our thorough evaluation and examination, where we get very hands-on. We not only have you go through a bunch of movements, but we get our hands on you. We assess all the different ranges of motion, we isolate all the different muscles and tendons to do our resistance testing to identify the specific structures, not just, oh, your shoulder hurts, it hurts when you lift it forward. That's all good and fine, but we want to know what specific structures. If it's rotator cuff, we want to know which rotator cuff tendons are involved.
Yeah.
If it's more of an internal joint issue, we want to know where, we want to know what. So we have a lot of different orthopedic examinations and special tests that we do to identify different structures and point out which ones are involved versus which ones are okay. And that tells us a lot, as well as your reports of what bothers you, when it bothers you. All of that goes into the assessment part of where we're determining, at least in our minds, what the issue is, or at least what the issue likely could be. And that's based on your symptoms and your different limitations. That's where we're going to develop our plan of care and develop our specific treatment methods to specifically identify and address those issues.
Right.
Not just, this one person with shoulder pain that comes in does not get the same treatment as the next person with shoulder pain, because
Right.
that could be two completely different issues that might require two completely different treatments. Some other places, that are the busier mill type places that have a high quantity of patients and whatnot. Sometimes those things get overlooked and you do kind of fall into that cookie cutter treatment. And we don't like to do that, because that's not going to help you. So we want to know specifically what's going on with you, with your shoulder, with your whatever injury you're coming from, and then come up with a very specific program for you with our manual therapy of what we do to you, as well as the exercises and rehab that we give you to do as well, to, again, correct that specific issue. That's going to give you your best outcome and keep you playing or get you back to playing as quickly and safely as possible.
Today's video is sponsored by Lucky in Love. Gone are the days of ladies' golf and tennis apparel that all look the same. Lucky in Love is ushering in a new age. The high-end women's apparel brings options fit for the modern, expressive woman. Partake in the ultimate luxury and shop Lucky in Love for your new favorite fashion items for women, and use code EB20 to get 20% off your next purchase. Quickly, let me go to the not quickly. I don't know why I said quickly. It's like sometimes I'm missing.
I got time, so whatever.
No, we got 10 minutes. There's a timer there.
Yes.
She just wrote it. What's funny? Don't even
So
say
out of
it.
it. You're so tired.
I'm so tired.
So let me get to the next question. Like,
Stop it, because I'm tired because I played yesterday and I'm tired.
when are you going to therapy to recover from everything?
Well, Mark.
You're like a Lego falling apart into pieces.
But no, I don't need anything specific. I'm just sore.
Rest.
And I need to rest. I need to get a massage, really, at this point. My shins hurt.
On that
therapy. My shins, my ribs, and my...
Now that I think about it.
No, okay. I think I pulled all of my left quad yesterday. So that's all bothering me. Then my shins are sore, though. What do you do for sore shins?
Again, that's going to be, it could be a number of different things when we get our typical shin splints and basically those muscles on the front.
Oh my God, it hurts.
Those are horrible.
It's similar to that tennis elbow where it's just that kind of chronic tension.
Yeah.
And that could be just a matter of muscle imbalance. It could be because of footwear, because of overuse.
Yeah.
All these different things, biomechanics and whatnot. So again, those are the things that we look for and try to identify so that we have a better idea of what specific things we can address and work on. And then same thing with we can get in there, we can get into that tissue, whether it's with our hands, our scraping tools, Graston, dry needling, and successfully kind of loosen that up as well, and then and just restore that balance.
I think I'll just let it be. No, it's because I'm training on clay court, and the
in
tournament
hard court,
was on hard, so that's why.
Yeah. So all of a sudden, different surfaces.
And I know why is it. It's
Yeah.
just whatever. But question: what do you think about the cold plunge? I'm just curious on your opinion on it because I had this trainer. He told me. He was like, you shouldn't do a cold plunge after the workout. You should do it before the workout.
There's actually been, I think, a
this?
lot more, I don't know if it's just recent, but I've been more aware of recent articles and research that have said that as well, from just a different, I think more, whatever biological standpoint or whatnot, from a systemic standpoint. For we've been doing ice baths and cold plunges and different types of cryotherapy forever, not just years, but not just decades. I mean, forever, particularly in sports. From a therapeutic standpoint, from a rehab standpoint, I guess let's put it that way. Generally, we like to heat before and ice after when we're talking about injuries, when we're talking about tightness, when we're talking about high level training. So it's very common to do an ice bath after a workout, after a practice, after a training session, so that we promote that vasoconstriction, that basically limit that inflammation build up and cool everything down. And from that standpoint, there have been a lot of which I don't know how well I can go dive into and give you a good scientific explanation, but I know there are some benefits, some scientific benefits of doing it beforehand. And there's people that will do a cold plunge right before their workout or training session as well. And I could talk about some of that, but I'm not well versed in it, so I'm not going to.
Okay.
And I have an idea. You know what would be really cool? If we had a segment that Mark comes in and people before she's already laughing at me. She's like, what is he gonna come up with now? And like he comes in and people DM us questions that like things hurt, so they're like, my neck.
Yeah.
I play tennis and my neck's will get a lot of pain when I serve. And then he comes in like,
that's a great idea.
Right?
Good job. You're close.
You like that, Mark?
Absolutely,
We should do
that.
We should do a live one.
That would be cool. I don't know how many followers going to be listening.
Put us on the
live.
spot. I like
We
it.
just make up questions because nobody's texting us anything. No, but
you're millions of followers, obviously.
Yeah, I think
That'd be a good idea,
that
right?
was good. Like prepared, like organized. It's so
Exactly. And people like DM whatever, like tennis problems or whatever.
Like only
hurt.
tennis related.
Yeah. Tennis players like DM us like, well, this hurts when I do this or whatever, and you're like giving them advice.
Yeah.
That'd be great.
I'm open to anything.
Or we should have done this now. Whatever.
What?
It's fine. Like announce that we'll be doing the podcast with him, and then whoever wants to send questions.
Exactly.
No, but send prior, not
Yeah. That's what I mean. Prior.
That's what you meant.
Prior, and then like we like, okay, we're gonna have Mark again. Like it's almost like a segment that we have every now and then with Mark.
Oh yeah.
You know what I mean?
Yeah. Oh, now it makes sense.
It's like injury time with Dr. Mark.
Once
Bank.
a month.
Exactly. You know what I mean?
Once a month is too much
That'll
because
be-
we only have 4 episodes a month. Once every 2 months.
Okay.
Let me know when.
I think that's a good idea.
I know the where. Just tell me the when.
What do you think about cracking your neck? Is it really bad for? I've heard it's really bad for. I want to show you how I do it, and then you're gonna tell me if I'm doing it. I've heard it's like horrible for you, but sometimes it hurts
Should
when
we
I do it.
be prepared to
I'm
catch
gonna
you,
do it.
or
So I go like this,
Don't.
and then
yeah,
I don't know if they could hear that. But that felt so good.
I think the actual sound that you're hearing, that pop, that cavitation as we call it, is just that gas that's being released from the joint. And that gas has natural endorphins and whatnot in it that give you that feeling of relief, right? That because it's natural, basically analgesics, chemicals that give you pain relief. And that's why it feels so good.
Right.
When you just get those cracks with active motion, in my opinion, there's nothing wrong with that. It's your active, normal normal motion anyways. Now, if you're grabbing and cranking and that's not typically something, and many are guilty of it, and sometimes you just end up doing it without thinking about it, right? You just do it. That's something that, I think a lot of physical therapists, probably any chiropractor that you ever walk by, is going to be like, don't do that. Right. Let them do it, because they're the ones that are going to specifically be adjusting or manipulating the specific segments in the safe way. So it's a loaded question because, are you going to injure yourself? Most people probably not, but can you injure yourself? Yes.
Okay.
I guess the easy answer is yes. So, if you ask a professional that question, you're probably going to get
okay. I'm going to chill with a neck crack.
I mean, I've honestly never seen anybody do that to themselves like that.
Yeah, it's good though. I also crack my back. I pull the skin.
Okay, it's fine. It's fine. You don't have to demonstrate anymore. Stop. You don't have to go to a chiropractor then, I guess.
I said true that chiropractors and PTs are Tamara told me this, that you guys are
So I think that's not an uncommon thing. What I've learned over the years, I've been a physical therapist for over 11 years now, and when you kind of come up through physical therapy school, you're kind of taught physical therapists are better, and when you go through chiropractic school, I think you're taught chiropractors are better.
Really?
And what I've learned in my years is that most physical therapists suck because it's the very generic, lack of better word, just crappy treatment. They're going to treat everyone the same, give you an hour's worth of exercises that you can do on your own, never even pay attention to you, and that's just it. And most chiropractors, same thing. You're going to get the very generic treatment. You're going to go in, they're going to crack your neck, crack your back, blah, blah, blah. You're in, you're out, and nothing's focused on you or your issues. What I've learned is the few but very, very good physical therapists and chiropractors actually all treat very similarly. I know some amazing chiropractors, and I also know only few amazing physical therapists, and I've worked with many. And that's not to dog on the whole profession. I just, and in the world of insurance and in that defense, it's just kind of almost it is what it is. You go into a lot of facilities and they have to crank out a lot of patients because, when you're going through playing the insurance game with the insurance rates and what they reimburse, they have to see a lot of patients or they go out of business. Right. And when you have that high quantity, unfortunately, the quality goes down. So I don't think that's an accurate representation. I think it's not about which one you're seeing, a physical therapist versus a chiropractor. It's just about who you're seeing and what their qualifications are and who they are as a clinician. Because again, I've known some amazing physical therapists and some amazing chiropractors, and I've known a ton of not so good ones of both sides as well. So I don't think it's one versus the other. I think it's just knowing that you're with a good quality clinician.
Aren't you going to the chiropractor after this?
The one that he referred me to.
How dare you?
Who's excellent.
Yeah.
Yeah. That's
okay. Good. Well, anyways, we're out of time.
I went by fast.
Okay, so we will. You can write your comments if you want any questions from Mark in the next episode, because we will do a segment with Mark, because Jose just.
I'm glad. Who comes up with these ideas?
You're just.
What a genius that guy.
Yeah, exactly. I'm so thankful and grateful and blessed that you're here. But yeah, thank you everyone for watching and for supporting. Please make sure to follow Mark where?
At USA Sports Medicine. You can follow at USA Sports Medicine and at Dr. Mark Blank.
Yes. And thank you, and we'll see you next time. Today's episode is sponsored by MatchSet. MatchSet is an amazing company that provides players with incredible equipment and apparel. With MatchSet, equipment does matter, and they make sure it won't slow you down.
Use code TennisWithEmma to get 10% of Match Tennis today.
Thank you so much for supporting and listening to our podcast. Make sure to follow us on social media.
And be sure to listen to next week's episode of the EMAzing Tennis Podcast.